tell us if there's cancer in the lymph nodes. The surgical report said there were no lymph nodes given to the pathologist. So I don't really believe, maybe the surgeon would have operated on the son, maybe he would have, but I have to believe that as a patient, the question is, where is the data? Where is the data?
Sure.
And that's what we're talking about. Don't ask questions that have some kind of nebulous answer. Ask direct questions.
Yeah.
Get the answer. Get a fresh second opinion. For this man, we can't put his pieces back together. We can't put his nerves back together. So really it's important. Get a fresh second opinion. We will help this man. He was told now there's nothing to do to help. Well, actually, that's not true either. He was told that by the surgeon. And actually, there's randomized studies of thousands of men who have surgery, and studies show to give radiation now does give that man a second chance, a true second chance. It's not guaranteed, but there's a second chance possible. So ask first, and ask the good question. What's the data? Show me the data, Doc. We have a word from our sponsor, the man with the golden voice, and then we'll be right back to take your phone calls and talk about more cases. For cancer treatment, most prefer effective, non-invasive, well-tolerated outpatient therapy. At Radiosurgery New York, the radiosurgery pioneers, that's our goal too. We're first in America, first in New York, first for you with body radiosurgery. We hit your cancer from head to toe with no cutting, no bleeding. We have decades of experience with primary and metastatic, large or small cancers. Cancer treatment with possibly a second chance for you, even if chemo, radiation, or surgery didn't work or isn't tolerated. Our goals are the best results and quality of life. Hi, I'm Dr. Gil Lederman. For a free booklet and DVD, call 212-CHOICES. 212-CHOICES for a fresh second opinion. Most insurances, Medicare, Medicaid accepted. We're super convenient, Broadway and 38th in Manhattan. Hyperthermia 2. To hit your cancer, call 212-CHOICES. 212-CHOICES for Radiosurgery New York. At Radiosurgery New York, the best prostate cancer treatment is custom tailored for you. Each man with prostate cancer is unique and seeks the best results based upon PSA, Gleason score, and stage. That's why custom-tailored prostate cancer treatment is most logical. Not every man should get the same treatment. Custom prostate cancer treatment here is outpatient and takes as little as 1 hour. Our goals are your best results, avoiding radical surgery, maintaining your sexual and urinary function, and your life. Most insurances, Medicare, Medicaid accepted. Hi, I'm Dr. Gil Lederman. Call us at 212-CHOICES, 212-CHOICES for a fresh second opinion and a free booklet DVD. Conveniently located in Manhattan at 38th and Broadway. For your custom-tailored prostate cancer treatment, call 212-CHOICES, 212-CHOICES. Cherish your life with custom-tailored prostate cancer treatment at Radiosurgery New York.
Welcome back to the Radiosurgery Hour. This is Rob Redstone here with Dr. Gil Lederman at the WABC studios in the heart of New York City. We're just a few steps from the Radiosurgery New York Cancer Treatment Center on Broadway and 38th Street. Dr. Lederman, the leading cancer expert, treats prostate cancer non-invasively. He was the first in New York with fractionated brain radiosurgery, and he's the first in America and in the Western Hemisphere with body radiosurgery. Hey, Dr. Lederman, we're back.
Speak a touch slower than you feel comfortable.
Right, because people understand less than
You think. And also, it sounds more thought.
Hi, welcome back. Here we are. Thank you so much. It's Gil Lederman. I'm from Radiosurgery New York, and we're here taking your calls. We're at 800-848-9222, 800-848-9222. I'm here with John, and we're taking your calls.
Yeah, we are live.
Why are we doing this show? John, why are we doing this show?
I think you have a lot to tell our listenership. You have a lot to explain in the cancer world.
Right. So we're trying to make people's lives better. So maybe someone out there has prostate cancer and they want to know what happens. They want to know if they ask a doctor, hey, what do you do with my son? Maybe that's the wrong question. So we're trying to get you some good ideas how to behave with your doctor.
Yeah.
Because sometimes it's important to know how to behave, how to ask the question. You ask a question, maybe the doctor hates his son. Who knows? There's all kinds of stuff out there.
No, I think we definitely take things for granted, and we don't, as patients, we don't really ask or look into things further than we probably should.
Right. So that's why we're trying to help you get the best health care, not do things that are harmful, and have a better quality of life. So here we are. We just put together new data. We're going to present it at national cancer meetings. So we're looking at several issues. We actually look at most all our patients and follow up and make sure our results are fantastic. So we looked at adrenal metastasis. So cancer sometimes gets in the bloodstream and spreads to different parts of the body. And radiosurgery allows us to treat any spot of the body non-invasively. So there's no cutting, no bleeding, no chemo, no surgery. So one site, and it's a typical site. A lot of people say, can you treat my cancer in the adrenal? If the cancer spreads to the adrenal, can you treat it? So have you ever heard about the adrenal gland?
Very, very rare.
It's not in Playboy magazine, right?
Okay, there you go, Doc.
If it was in Playboy magazine, probably you'd know about it.
I'm the average guy, and that's why I'm sitting next to you today.
Right, so you probably, well, that's why I asked you a question.
Yeah, no, that's what
I'm here
for.
talking about the adrenal metastasis, but most people haven't heard about the adrenal. So adrenal. So renal means kidney.
Right.
These are all Latin words.
Sure.
Ad means above.
Okay.
So it's the gland above the kidney.
Simple enough.
And it makes a lot of hormones. If you knew it made your hormones, you might be more interested in it.
Well, now we're getting a little more into it. So
it makes your steroids, it gives you energy, it gives you pep and vitality. It makes us all get up every morning and smile. That's the adrenal gland. You need your adrenal gland. Remember President Kennedy had Addison's disease. I don't know if you ever heard about that.
I've heard of. I knew he did have that, but I tell you, I don't know much about the disease.
So Addison's disease was a deficiency of the adrenal gland.
Okay.
And he was on. I just saw this movie. What the heck was the movie? Oh, The Butler.
Oh, okay. I haven't seen it.
Okay, so it's a movie with Oprah Winfrey, and it's talking about a black man, really a sad, tragic man who lived a life as a child in the cotton plantations.
Yeah.
And his patients were killed by their cruel owners, it looked like. And the boy escaped. And eventually he in the plantation he was brought into the house to be a servant. Mm-hmm. And then he left there, and he went to the finest hotels in Washington area, and the White House heard about him and recruited him to be on the staff of the White House. You can imagine a boy was on plantation,
right,
and not going to the White House.
Yeah.
And he served for about 30 years. And one of the books he brought home was on Addison's disease, and he wouldn't say that. They were sworn to an oath that they couldn't tell what they learned in the White House, what they heard. So his wife, which is Oprah Winfrey, was never allowed to hear all the little details.
Sure. I can only imagine what goes on behind those doors.
Right.
Now and then.
So maybe better or more interesting back then.
Maybe, yeah.
So he brought home a book about Addison's disease. So Addison's disease is when the adrenal gland doesn't function.
Okay.
And Kennedy had that, and he was taking medicines. But that's the adrenal gland. So we treat cancers in the adrenal gland. And we've treated scores of cancers over the years, and we follow up the data, and people have been followed years, and there's 91% control rate, which means we can stop the cancer. And unlike chemo, we're not talking about for 3 weeks or 6 weeks or 10 weeks. We're talking about for the rest of the life of the patient. So the beauty is that we have a 90% control rate, and different doses give different responses, so we try to get the best possible dose. And because we were the first ones in America, the first ones in the Western Hemisphere, and by the way, the first ones in New York, which is also in America in the Western Hemisphere, right?
Yep.
So we have a lot of knowledge about what dose should be given. And we do true stereotactic body radiosurgery in a stereotactic frame. So this is the results and I'm showing you the results. So we've got graphs and data, and we're presenting it at for consideration at the national cancer meetings. There's cancer meetings for chemotherapy doctors and for radiation doctors. So we want more people to know about the work we do so they don't necessarily get endless chemo or surgery for a disease that could have 5 simple treatments and most likely knock it out of the ballpark.
Yeah.
And obviously we can treat other areas in the lung and the liver and the brain and pancreas and so on, bone. So here's the data, and we spend a lot of time with our data. We have data managers and big computers and programs to make sure we keep up to date with all our data. So that's our data. And the question is, what's the data, Doc? Come here and we'll show you the data. We have another patient to talk about. I want to talk about that patient. We had a woman who came to us that's relatively young, again, 60-year-old woman. She lived in the Caribbean, and she had colon cancer. She had terrible pain in the pelvis. She was seen by doctors there, and they found the cancer as a rectal cancer. She had standard radiation, which was about 6 weeks of radiation and chemo. It didn't work. And then she came to New York, and she had also at a big hospital, 1 year of chemotherapy.
1 year. Wow.
1 year of chemotherapy. And like I say, if you're getting a treatment and it's not working or not tolerated, you may want to think about another treatment. So for her, it took her a year. Now, she had a mass in the belly button. It's like the adrenal gland. The belly button you do think about, right? Sometimes you even look at a belly button,
I guess
right?
so.
Yes or no?
Sure.
Okay, so little bashful smile here.
Yeah.
So cancer can travel to the belly button.
Really?
The name is umbilicus. So cancer can travel, and in fact, there's a name for that. It's called the Sister Mary Joseph. Now, why is it called that? Well, legend has it that a patient was being examined, and the doctor felt this mass in the belly button, which is normally nice and smooth and soft, right?
Right.
And there was a mass that was rock hard. I mean, that's what we tell people. If you feel something that's suspicious, call us. Call us. So there was a mass in the belly button. They even biopsied it and found there was cancer.
Right.
And they kept on giving chemo for a year. And the mass got bigger and the cancer got worse. And finally, she just was fed up with the chemo. She came to us. The cancer was unresponsive to a year of chemo. We saw her. I saw her this week. I saw her January 28th, which is this week. She was told elsewhere she couldn't have more radiation because she had radiation to the rectal cancer.
Okay.
Not true. Not true. We've given more treatments. It's called reirradiation to cancers in the same area or in other areas. Well, this was another area. This is the umbilicus. It's not in the rectum at all.
Yeah, right.
So another learning point. You can treat. You can retreat. And if you give a few very intense treatments, it works better. So she came and she's really was hot to get going, hot to have a chance. We staged her up, so we found exactly where the cancer is. We offered treatment and started treatment all within a few days. And we like not to make people wait.
Yeah, sure.
So, again, based on our data, the chance of controlling this cancer, stopping it or shrinking it so it doesn't cause all these painful problems, is about 90%. So
Wow.
it's very high. And I brought a picture. This is actually a picture of her abdomen.
Okay. I'm taking a look here.
I don't know if you can see this big mass.
Yeah, I can. Wow.
So there's the skin. Here's her body.
Right, yeah.
There's intestines. And here's a mass starting from the muscle wall. That's the muscle wall, going all the way to the surface of the skin. So it's like the size of a fist.
Yeah, it looks exactly as you described it. That's exactly
Like
what we're
the
seeing.
size of a fist.
Yep.
And on the surface, if you could see it, it's all eroded, ulcerated, mass, hard, painful. So she's going to get 5 treatments, and most likely we're going to be able to stop or shrink that and take away the pain.
Good.
And we staged it up. We found other cancers. I told her, look, if you like our work here, I like to prove things to people rather than to give them a year of chemo. Let's prove it. We'll prove it. Let's prove we can get you better, prove you can feel better, prove you that the cancer is shrinking. And then if you want other areas treated, we can do other areas too. So, of course, we wish her well and treating her in the best possible way to get rid of this terrible pain and suffering. So,
here's
got
Dr.
this man.
Gil Lederman, New York's only Harvard-trained, triple-board certified radiation cancer doctor.
If chemosurgery or radiation isn't working or isn't tolerated, when cancer and its pain and symptoms aren't getting better, seek a fresh second opinion at Radiosurgery New York's Urgent Cancer Consultants for innovative, custom-tailored cancer treatment.